So my capstone project looked at the most effective AAC devices or strategies at decreasing communication barriers in acute medical settings. So to start, we'll look at the scoping review that was conducted, and this was done to look at the current literature surrounding this topic. During the research, it found 604 articles and additional 416. After several steps, there was 20 articles that met inclusion and went through critical appraisal. There were 3 themes identified in the 20 included studies, including low-tech devices and strategies, high-tech devices, and then medical personnel trainings, usage, and/or strategies. All devices and strategies were found to be effective, therefore they should all be considered with patients in acute medical settings. Factors that increase a device's effectiveness include evaluating patient as whole, utilizing multiple healthcare professionals like speech, OT, and nursing, and then utilizing multiple strategies or devices to help meet all of patients' communication needs. So on the left here is the Prisma diagram that was created, and it shows how from the initial search, how many studies were found, and then how it led to the 20 included studies. On the right is my concept map, and it just reviews all of the themes and then the sub-themes created and then how the articles were matched accordingly. So for my capstone experience, I was at University Hospitals Cleveland Medical Center. I was in their ICU, and then my main role was to look at AAC devices in the ICU and then create communication resource boxes for the units. So in the boxes were several low-tech items as listed below, and then a caregiver handout just to review communication impairments with family members, and then go over some strategies they could use. So the boxes in the middle, on the left was an eye gaze board created for the site, and then we have several communication boards, including a picture needs board, a letter board, and then a pain board. So to integrate the findings from the literature on site, a case study was conducted following a needs assessment using a protocol that was based on the recommendations and through discussions with speech and OT. So the patient in the case study was trached and in the ICU following surgical complications. The protocol required modification leading to OT-only assessment for communication, and then they selected a letterboard and then a writing device to meet his needs. So it was found that the writing device via the whiteboard was preferred during his 48-hour follow-up session, and it was found that the outcomes showed he had an increase in his communication, an increase in his communication satisfaction, as well as the nurse's satisfaction, and it improved his psychosocial factors. So since the protocol that was created for the case study couldn't be implemented as recommended, an implementation analysis was done with 4 ICU professionals to see if they thought their recommendations could be implemented on site and what barriers and facilitators they thought the site had. So overall, they do think the recommendations can be implemented, but things like lack of time, limited staffing, and then the unpredictability ICU make it difficult. So following the implementation analysis and then the case study, it was concluded that once a patient has identified communication barriers, the question of whether the patient is trached and then appropriate ventilator settings and or if they have a language impairment will be asked. If the answer is yes, it will be a speech assessment for communication to select device. If the answer is no, it will be an OT communication assessment and the selection of the device. Following the selection of the device, OT and speech will cross-communicate, and then there will be nurse and family education on the device to increase carryover. There will be that 48 to 72-hour follow-up rate window to assess outcomes, and then what was added was additional communication sessions if needed, if there is a change in communication status or medical status. So one question someone may ask about my project is why was a scoping review conducted? So a scoping review allows for a broad look at the literature on the topics that aren't heavily studied, which this area is not, and it just allows you to look at broader populations, doesn't really give exclusions to settings, populations, anything like that. So you can see what is currently out there and then suggestions for future research. Another question is how were the items in the boxes created and why were those suggested and made for the boxes? So one thing was low-tech items were used just because high-tech was out of the budget for UH. So things like communication boards were easy to make and they had access to a software to create them. Whiteboards and then writing materials are common for patients in the ICU, and these are pretty easily to get, and then they're great options for patients. The IGACE board was created just because UH occasionally has higher level spinal cord injuries, GB patients, or locked-in syndrome who would benefit from this type of device. And then the things like adaptive call lights are good because call lights are how patients in acute care and ICUs get their nurses. So having adaptive call lights like a breath call light or easy tap allow them to use their call light. And then the other thing is how was the divide between OT and speech made. So it was agreed upon between the OT and speech on site that because of limited time frame, it's hard for both to do an assessment on one patient. So they decided to do a split in order so all patients have their communication needs met and they don't feel overwhelmed. So OT would take more of the intubated patients or patients not on appropriate ventilator settings because it's more of an access method for communication, so assessing their vision, positioning, and upper extremity skills. Speech, on the other hand, will take patients on appropriate ventilator settings and with a language impairment because that would fall under more a speech realm for communication assessment.